Another thing I was excited to read about and I want to learn more about is the EECO methodology. So
Yeah.
could you tell us a little bit about that?
Yeah, thank you. So I'm sure you get this a lot. Like people ask, what do you do? How do you treat
Yeah.
people? What's your approach? And so that was just a kind of framework that I distilled to really communicate my thought process and how I develop protocols. And so it's really the combination of really everything we just talked about, with the first E standing for environment and terrain. So very much looking at, I'm a terrain person, right? So looking at how do we strengthen the terrain, reduce the environmental burden, support the microbiomes in the body, the immune system, and then the second E is all about energy systems. So this is the biofield, and this are biofield therapies, and understanding that we are, wired this way, and to bring in integrate tools of energetic in nature. And then C is clearing the blocks. So a big part of my role is looking at interference fields, and I'm sure you do this as well. And interference fields are this idea that came out of bioregulatory medicine that the body is always working to self-regulate and heal, and if when we have an illness, there's something interfering that capacity, that regulation, that communication within not only the autonomic nervous system, but I think the fascia and the biofield as well. And so we look at scars, we look at focal infections, and often in our patients, the tonsils and the sinuses are focal infections. And then the mouth, right? So the mouth is a huge part of our work. And we work a lot with biological dentists that, are very well trained to look at toxicity from, of course, amalgam fillings, root canals, cavitation. So, all of that, is very much still a part of our work. And I think that that's catching on more, but there's still more education that needs to happen, around interference fields, because I think it still gets quite missed in the chronic illness, population. And then the O is all about optimizing flow and drainage. So as we've talked about, we're only as healthy as our body can eliminate, right? So we have to really, any protocol that I create, we're always thinking about supporting organs of elimination, supporting the lymphatics. The lymphatics are a huge part of our work. And again, still very much overlooked, and even in the chronic illness community, so not only, if you take a couple things away from this lecture, of course, the biofield and energy or energetic nature, but if you're still struggling out there thinking about interference fields, and are you really having enough tools to support your lymphatic system? Because the lymphatic system is our waste clearance system. It's where our immune system also mounts how they respond to what it needs to mount. And even if you're thin, you can have a congested lymphatic system, and it's a body-wide network. So if there's congestion in one area, it can affect drainage in another area. And we need the whole system to be flowing for our brain to drain, our gut to drain, all of our extremities, breast health for women, even reproductive health. So I think that's still, unfortunately, I know you address it, but I think it's still very much overlooked, and it's very rewarding to treat, because when people haven't been addressing their lymphatics and you get that going, that's when they get a lot more movement in the body. So that's my framework, and it's not linear. It's kind of all at once. All of my protocols have those buckets addressed when we're coming up with a plan for a patient.
No, it's great because it's comprehensive again, and it's looking at all the root cause and trying to address them in a personalized and tailored way, which is again where medicine needs to go. I'm not saying there's a right or wrong way about that, right? Everyone has their own way. We use bioresonance a lot, some HRV, we use BioWell, all these other things as well. And it gives us the picture, and then you can personalize off of that and get into that, whether lymphatic stagnation is there, whether emotional issues, energetic, past traumas, all of that needs to be addressed.